Today I shall be talking about osteoporosis. What do you mean by osteoporosis? This means that there is pores in the bones. In osteoporosis, there is both qualitative and quantitative defect in the bone. When I say quantitative, it means that volume, decrease in volume. When I say qualitative, this means decrease in density. In osteoporosis, there is decrease in volume and density of the bone. In normal bone, there is 35% matrix, which contains protein and collagen, and 65% minerals, which contains polyhydroxyapatite calcium carbonate and calcium phosphate. In osteoporosis, both matrix and the mineralization is decreased, but in osteomalacia, only there is decrease in density of the bone. So matrix remains normal, and there is defect in the mineralization of the bone. You can also remember as malacia and defect in mineralization of the bone. Now, types of osteoporosis. There are two types of osteoporosis, primary and secondary. It is called primary when there is no other disease associated, or this osteoporosis is not due to any drugs. In this, there are also two types. Type 1, postmenopausal. When postmenopause starts, then there is decrease in the hormones, estrogens, which causes osteoporosis. Type 2 is senility. This is the most common. As the person becomes old, there is decrease in the absorption of the calcium and the vitamin D, and intake of the calcium and vitamin D, so it causes osteoporosis. It is called secondary osteoporosis when there is other disease associated or due to the effect of other drugs like disease like rheumatoid arthritis, tuberculosis, ankylosing spondylitis, and drugs like corticosteroids for a long duration. Then these diseases are the primary disease, and osteoporosis is the secondary disease. Talking about clinical feature, it causes polyarthralgia, means pain in the multiple joints, polymyalgia, pain in muscles, low back ache. This is the most common symptom. As vertebra and the spines have become weak, it is unable to tolerate the weight of the patient. Pathological fracture. It is called pathological fracture when there is fracture in the bone which has already become weak by the disease. This is also called fragility fracture. As the bone becomes fragile due to disease, this most commonly occurs in the dorsolumbar spine, neck of femur, and Colles fracture. Radius fracture. Talking about investigation, we have to do X-ray. In X-ray we can see the codfish appearance. Fish mouth appearance. Suppose this is the normal vertebra. Then in osteoporosis, in osteoporosis the X-ray the vertebra can be seen like this. This looks like fish mouth appearance. Codfish appearance is also seen in first most common is osteoporosis, then spherocytosis, sickle cell disease. But X-ray is visible only when there is 30 to 40% of bone loss, which is prone to fracture. So we need to perform another investigation. This is DEXA scan. In DEXA scan, we measure the bone mineral density of same race, gender of old person with same race and gender of young individual. Suppose there is a 65 years male, Nepali male whose bone mineral density is X/4, and there is 25-year Nepali male whose bone mineral density is X. Then T score is -4 and his T score is +1. So we have to interpret the T score value. If T score value is between 0 to +1, it is normal. When this is -1 to -2.5, it means osteopenia. It means there is slight decrease in bone mineral density. But when it is -2.5 to -4, then there is osteoporosis. It needs to be treated. Now talking about the treatment of the osteoporosis, in this osteoclastic activity has been increased and osteoblastic activity has been decreased. So we have to decrease the osteoclastic activity and increase the osteoblastic activity. For that, drugs that decrease osteoclastic activity. Bisphosphonates, Alendronate and risedronate is given once a week. Evandronate, this is given once a month. And zoledronic acid, it is given once a year. Second, we can give estrogen as an hormone replacement therapy. Third, we can give selective estrogen receptor modulator, tamoxifen, raloxifan. It is called selective. As in breast tissue, it decreases the growth of the breast tissue. So it is given in the treatment of the benign condition of the breast, as in fibroadenosis. But in bone and endometrium, it causes increase in the tissue, bone and endometrium. Decrease breast tissue. So given in benign condition of breast, like fibroadenosis. But in bone and endometrium, it increases tissue. Calcitonin, it reverts the action of the bone resorption, decrease the bone resorption. Fifth is denosumab. This is the monoclonal antibody which binds to rank ligand and decreases the osteoclastic activity. Now drugs that increases the osteoblastic activity. Parathyroid hormone, when it is given in low doses, it increases the bone formation, but when it is given in high dose, it causes bone resorption. Now drugs that have both dual action, that decreases the osteoclastic activity, and increases the osteoblastic activity. Strontium renalate. But this is not widely used nowadays as it is nephrotoxic. Now surgical treatment. For this we can do vertebroplasty. Vertebro means vertebra and plasty means to change the shape. In which we can inject cement in the vertebra. This is called cement, but actually this is liquid. Polymethyl methacrylate. That's all for osteoporosis. Thank you.